Evening, everyone. Thanks for joining us. I'm Natalie, and I'm joined by one of my colleagues who will introduce herself shortly. This is our part of our ASHA application, preparing for interview and nursing, for nursing and midwifery interviews at Middlesex University. The mics are all muted. If you've got any questions, please use the Q&A, and this recording will be it is recorded, this session, and will be shared with you afterwards as well. So I'm joined by my colleague Caroline, who's going to introduce herself now.
Hello, I'm Caroline and I'm in charge of recruitment at Middlesex and one of the nursing lecturers. And I'm here today to deliver this presentation to you and also answer any questions you might have about nursing midwifery, both interviews and the programme. So as Natalie said, if you have any questions, please feel free to add them and we'll deal with those at the end. And I hope I can answer all the questions as we go along. Okay. These are some of the things we hope to be covering with you today, looking at our entry requirements, how to apply, and our some of our application processes, what we offer in terms of placements for you. Natalie will probably talk to you a bit about personal statements, a few hints and tips for you, and also about preparing for your interview. So all nursing and midwifery students are required to attend an interview via Zoom with us. So for those of you that don't know, we are in Hendon in North London on the Northern Line. That's our main campus, Hendon Central, and very well served by public transport, by trains, tubes and buses. And we have our placements, which we'll look at in a bit more detail, very close to us as well. But that's hopefully a helpful map about where we are. But we're on Hendon Central on the Northern Line, just up from Camden. There we are. So what do we need to tell you about nursing? Well, as I'm sure you know, as you're all interested in nursing or midwifery, some of the things that people find attractive about it is that the course that we offer is very career focused. So we're offering the chance to study academically to degree level, but also you're going to be working alongside registered nurses, registered midwives. So you'll have the opportunity to study in our hospitals, but also we organise your placements for you. But we have the most incredible skills centre called StoneX, which has augmented and virtual reality that helps you gain your confidence in your knowledge and skills. You're taught by expert academics. Many of our nurses and midwives are still working in clinical practice and they bring that knowledge with them. We also have you being taught in clinical practice by experienced nurses and midwives. We work very closely with our trusts across North Central London, and we'll talk about those in a bit more detail. And also, we offer you a lifetime career support. So I'm a Middlesex student and I'm a Middlesex graduate. I studied my degree and my master's and my doctorate at Middlesex. So I'm very much Middlesex through and through. So this is what you'll be studying. You have 4 modules every year. And that's the same for all 3 years. Also, you have, just in the middle at the bottom there, practice learning, which includes clinical placements, and that is 50% of each of your years. So your placements normally start around January, February time. And then that backs up the theoretical knowledge and expansive learning that we've given you in class. So you are assessed in practice, you're assessed by the registered nurses. So you have to pass your placements as well as your theory. So theory includes being in class usually 2 to 3 days a week in your term time. And you're studying modules such as scientific and nursing knowledge, which gives you the basis for the nursing skills. Then your expansive learning when you're looking at dealing with some of the professional practice issues, such as ethical, decision-making, critical thinking. Again, practice learning, clinical placements, skills labs, and your actual practice modules. So each year contains all of these, and they gradually build year on year until you have finished your 3 years. We have one exam at the moment, and that's in year 2. The rest of it is you're assessed in a variety of settings, such as essays, demonstration of skills, obviously your clinical placements. So lots of different ways we work with you and assess you. So this is a bit of a little picture of what our skills lab looks like. Excuse me. So these are real life mannequins in their beds, proper hospital beds, and you can see it looks like a hospital ward. So these mannequins can breathe, we can change their pulse rate, they can talk to you. So depending on what you do to them, depends on how they react and how they behave. And it's all in this place called StoneX, which is our clinical skills lab. So also we record your progress so we can look at it and review it with your colleagues and see whether we can learn from each other and develop our skills and knowledge even further. So these are some of the areas that we will be sending our students in placement. As you know, that we have 3 areas of nursing and midwifery. So we have adult nursing, child nursing, and mental health nursing. So you could be working in a variety of these settings, such as GP surgeries. Obviously, we've talked about the virtual ward, care home CAMS, which is child and adolescent mental health services, hospice care, prisons, charities. So you can see you've got a great many learning opportunities as well as hospital and community. That's not a great picture there, but hopefully you might be able to see some of our placements. So we sit across the top of North London, and we also have our community trusts. So we have the Royal Free, the Whittington, the 2 mental health trusts, Camden, Islington, and Barnet, Enfield, and Haringey. We have some midwifery placements at Whipps Cross and Romford. And we also have Barnet, Chase Farm, the North Mid, and the National Orthopaedic Hospital.
Do you do anything in Gosh and Barts? Because they're
Not at the
there.
moment,
Not
but
at the
we're
moment.
hoping to. We do a lot
Okay.
of post-reg with Gosh at the moment,
Yeah,
but
yeah. Okay.
that might develop further.
Mm-hmm.
So the entry requirements, we are looking for 112 UCAS points, and we will take BTEC, Access, A levels. We also take international qualifications as long as they're equivalent. Excuse me. And also with that, we need your maths and English at level 2, and we take key skills or functional skills as well as GCSEs. All students will need to attend an interview. So once your UCAS form comes through to us, we shortlist you and then we invite you for interview. So lots of people get very stressed about interviews and worried about it, but we're very kind here at Middlesex, and we actually send you the information to help you prepare. So you'll have some of your questions in advance to help you prepare for your interview. So you'll know the types of things that we're going to be asking you. We also send you some links to help you prepare as well. So links to useful information that will just give you an insight into the types of things we're going to be asking you. So, for example, why have you decided you'd like to study to be a nurse? And you might have some personal examples that you would like to bring along to that, to talk to us about. It might be something that you've put in your personal statement that you'd like to develop a little further and explain in more depth. One of the big things we're really keen to see is that you really understand about the course, that you really do know what a nurse does, because we'd be anxious about taking people who haven't really explored the course and the career. So you might think, oh, I really want to be a nurse, but do you know what they do? Have you any clue about what nurses actually do? So make sure you've explored that in a lot of depth about what you're going to be doing, the types of things you're going to be involved in, the role of a nurse, the role of the nurse in a team, the role of the midwife, and what they actually do. Tell us about your work experience. Lots of people say, oh, I haven't got any clinical experience. That's absolutely fine. We don't expect you to have. It's quite difficult sometimes to get clinical experience. So tell us about any other work experience. Have you volunteered anywhere? Do you work as a job? Because anything that has customer care skills is going to be really useful in your nursing career. And that comes on to your next thing, which is your experience, your transferable skills. Some of your transferable skills may come from your studies. Obviously, you've got things like teamwork, self-management, time management. These are all skills that you're able to develop over the years through your studies. And tell us about some of your things you've achieved that you're proud of. Now's your chance to talk to us. Tell us all about you. That's what we want to know. So it might be an idea just, having a little think about what you would regard as your personal qualities and how they'd make you a good nurse or midwife. One of the things we ask you to look at is what we call the 6 C's of nursing, and these are included here in this list. communication is key to whatever we do in life. And listening and talking, looking at non-verbal communication. This is where things like customer care skills come in, because you'll be used to dealing with the public and talking to them and reading the signs. Have you got a genuine interest in caring for people? So we need to tell us about your compassion, your empathy. Have you had an experience of that in any settings? We're looking for motivation, looking for you to be committed and enthusiastic about the career that you've chosen. Obviously, living and working in London, we have a very diverse community around us, and we need to understand what equal opportunities means for everybody. Team working, very important question. Healthcare really runs on teams, and you will have had experience of teams in lots of different settings. So you might have an example that you'd like to share with us about your team working, whether it's a school project or a work project you've been involved in. Obviously, all nurses and midwives need to be reliable, dedicated, and on time. It's very important. Problem solving is a very big part of what we do as healthcare professionals. We're often weighing up the decisions that we need to make, critical thinking, decision making, problem solving. So have a think about how you solve problems and your role in that. And also don't be frightened of asking questions. You've got academic staff in front of you who are experienced clinicians, experienced academics, who will be happy to answer any questions that you might have. And you will be asked at the end of the interview if there's anything that you would like to ask us. So Natalie, I'm going to hand this one over to you.
Okay. So obviously some of you will have applied or you're just about to apply as well, because the deadline's coming up from UCAS. So think about your personal statement. You need to start it early and ensure that you mention all those things that Caroline spoke about, that you prepare for interview, but you go into depth in that, whereas you can put similar things in your personal statement, but you are going to elaborate on those on your interview. So things to think about is, don't use Google and use interesting quotes. Don't copy anyone else's work. Make sure you check all your spelling and grammar, and start it early. And if ask somebody else to read it for you, is what I would say. And make sure you've done your research on the area of nursing or midwifery that you want to study, because that's what we're looking for in your personal statement.
Also, if you get a chance, we always recommend this, but please come and see us at an open day, because you'll get a sense of the university, a sense of your travel. You get to meet students as well as the academic staff. Again, these are a bit more about some of the things that we would like to see you demonstrate in your interview and in your personal statement. Some knowledge and awareness of midwifery. You might have seen something that you found, or nursing, sorry, that you found interesting. So, for example, this year we've had issues with epidemics in measles in children. We've had a lot of work around ethnicity and recognition of ethnicity in midwifery. So any of the public health things, are we heading for another epidemic? We don't know at the moment. And that comes into your contemporary issues in the NHS. Tell us a bit about working with others, that you understand some of the challenges of the course. This is a stressful course. Wherever you choose to study it, whichever field you choose, whether it's nursing or midwifery, it will be stressful. You are dealing with people who are at their most vulnerable, they're most anxious. So how are you going to deal with those days that didn't go as well as you'd hoped? What kind of skills have you got that you can use to look after yourself? As we talked a bit before, personal awareness, empathy, caring, non-judgmental approach and culture. Sorry?
Oh, is that you, Karen? Sorry.
No.
I was just going to say, if you get invited to interview by Middlesex, you'll get sent a guide similar to this. It won't look the same as this, and with all the relevant information in there, including some questions as well.
Yeah, so we help you prepare for your interview, so you're well aware of what it is we're looking for, and what we're asking for.
And within that, you'll be sent some questions that we want you to prepare for, which Caroline has just spoken about.
Yeah, so as we said, the 6 C's of nursing. Perhaps you'd like to think of some examples that you could demonstrate that shows how you link to the 6 C's, some of your own personal values and how you've developed those over the years and how you've developed them.
Yeah. So basically, what do you think are the most important personal and professional qualities of a nurse? That's what you're going to get asked, and they're going to look for some examples of that. So ensure you've read around all of those sorts of things. Yeah.
Okay.
Should we go to the next one?
Yeah. So this
Um,
is a key question that we ask our students. So what do you think registered nurses do? So if you're talking about children and young people's nurses, it's quite different to being an adult nurse, but all nurses have the same approach to the care that they give. So nursing isn't just about caring, it's about assessing, planning, monitoring and evaluating. And then think about who do they work with? What types of things are they involved in? Think about looking after seriously ill people. What type of things do they need from you as a nurse? What sort of things are you going to get involved with to help your patients improve? Or it may be that some of your patients won't be getting better. Some of your patients won't be going home. So what's your role then with somebody who's very, very poorly?
number
Obviously,
3.
as I said,
Okay.
everyone's very keen on finding out what you think about being part of a team. And everywhere you work in life, you will be part of a team. I think there's very few jobs where you're actually working on your own. So spend some time thinking about that. Think about, have you been involved in projects at college that it required you to work as a team? And what did you learn from that? So teamwork is vital in healthcare. And also you might like to think about how the 6 Cs can be used in teamwork, because obviously communication is vital, but any of the others.
Mhm.
So on top of that, so those 3 questions are definitely coming your way, but we might well also ask you about your time management skills. How do you prioritize your workload and study skills? We will be assessing your ability to communicate effectively and looking at your interpersonal skills. We know you're nervous. Don't worry. We're used to dealing with students who are nervous. And, we happily prompt you and give you time to answer your questions. Thinking about diversity and what that means to us as healthcare professionals. Showing a reflective approach, which again means you bringing your life skills and knowledge to the interview and showing us what you've learned and how you've learned it and how relevant it is to being a nurse or a midwife. And what are you going to do, as I said, about some of these emotive situations? Because what we want to see is that you have insight and understanding about what you will need to do if you're finding things tough. So anything you want to ask us at the end of it. So if students ask us things about how can you ensure you're successful? What can we do to make sure you're a successful student? Because we don't just want you to get through your 3 years. We want you to qualify with a really good degree and get a good job and enjoy your time with us. It goes very, very quickly, your 3 years. It might not seem like it, but we want you to be successful and enjoy your time with us, grow your knowledge and skills, gain confidence so that you emerge as a fully rounded practitioner at the end of it. Middlesex is known for the support that we offer our students. We're a very supportive university, and we have a whole section on it on our website about the support that we do offer. And that includes things such as the library being open 24 hours a day. We have no library fines. We have free printing. We have laptop loans. So lots of help and support available. One of the other things students get quite anxious about is preparing for their programme. And at Middlesex, we start to work with our students to get them ready. So we don't just start you as a student nurse in September. We will be helping you to prepare before you start with us.
Okay. So they're the questions that we will ask you, and some of the questions that thinking about how you can prepare to ask us some questions when you go to interview. Not sure if you've seen the university recently. We've got an NH. We work very closely with the North Central London Training Hub. As Caroline said, we work with lots of trusts across the NHS. We We've got an event on the 6th of March, which is where all the NHS will be. We have about 50 stands there. If you would like to come along and meet all of our academics plus all of the trusts, then you're welcome to do so. That's on the 6th of March. But also we do have an open, if you haven't managed to visit us and want to visit us and can't come to that, we've got an open day on the 22nd of February. And also campus tours run every Wednesday from 1 till 4, which you are welcome to join.